Let's go ahead and wrap up some of those animated conversations and plant for another hour or so of learning. What'd y'all think about Judy? Huh? Okay, guys, be honest. Did you pick up some tips about your marriage or relationships? My favorite slide was the one about going into the mall. All of those red lines, if she would have had a vendor for every one of those, on a monthly basis, each one are represented on my credit card statement. That was a very true slide. All right. Well, thank you all as we segue more or less away from our Medicare focus this morning over into the Affordable Care Act focus for this afternoon. Our goal here this afternoon over the next couple of hours is to give you a little bit of information. I wish that we could give you a lot of information, but I'm going to just tell you, it's probably going to be mid to late October before any of us really know what's going to happen on November 1st. Let me repeat, it will probably be the end of October before we really know what carrier is going to have what products on exchange, off exchange, HMO, EPO, PPO. Will they bring it to the market? Will they have it approved by CMS? If they do get the approval, will they bring it to market? It's all about networks. We are segueing away from a PPO market and into an HMO market. Don't shoot the messenger. But if you look no further than California, I think you would probably agree with me after you study that market that it is a market that works. The HMO integrated care model will work. We've just got to be able to accept it, recognize that it is a change in our business, and react accordingly. And that's what I hope you get out of this afternoon, and that's specifically what I hope you get from Mr. Randall Mitchell. Randall represents the Baylor Scott & White health plans. He's in charge of basically the ACA and Medicare, but he's going to address us today on the ACA side of the fence, give you some thoughts and ideas, and I will just encourage you to get contracted with Baylor Scott & White today, utilizing our systems in the back, in the front. We have online contracting systems set up and ready for you. If you can't do that today, do it this week. You will need this health plan, this open enrollment. Randall, come up and tell us all about why.
Have to be alone if you say you will. Darling, I want you to say you will. Darling, I want you to say that you will.
Well, good afternoon. After everybody had a nice, pleasant meal, and it's difficult to come after a great speaker like Judy, but I'm going to do the best I can to value. I know I value your time, and it's important that I give you some selling points. What my job today is because we really don't have the final product approval at the Scott White Health Plan, we're going to show you some of our drafts, and on the benefit slides, it's going to say pending CMS approval, because we yet to have received the approval. I will tell you that we are in the midst of going across our service area, talking to agents all across the Dallas-Fort Worth and Central Texas, and introducing them to the Scott White Health Plan. But very quickly, my job today is to let you know that this is going to be what we believe the health plan that your clients deserve. We're coming into a new world. And by the way, how do you like that? I don't change. But I am the vice president, as I said earlier, of retail and direct consumer strategies for Baylor Scott White Health. I like to refer to myself because, you know, I've done many speeches on salespeople and sales. And I love salespeople. I have a very big part in my heart and love for the art of the sale. And what part of the talk I'm going to give today is on selling points. We're going to talk about our products, but I'm going to give you selling points, and that's what you need to use when you're talking to your clients. This is probably my favorite slide because this is where I'm going to start with selling points. It's the difference. How does and what makes Scott White Health Plan different? Well, number one, we're part of Baylor Scott White Health. Does anybody have an idea how big Baylor Scott White Health is? We're a part of an organization that has 45,000 employees. That's a pretty big company when you consider it. We're only in Central Texas and North Texas. We're very proud to say that we are the largest nonprofit healthcare system in the state of Texas. One of the things that I'm most proud of saying is that not only are we the largest nonprofit healthcare organization in the state of Texas, but we're also a faith-based organization. Not only do we have, do we profess that, but we also have a chief missions and ministry officer at our company. We practice what we preach. We are a community-based company, and we are faith-based. I think we may be the only faith-based organization of our type that spans the insurance field all the way to healthcare in the state of Texas. Very proud that we can say that. We're the only integrated healthcare system in the state of, in our service area, not in the state of Texas. There is one other integrated healthcare system, and that's in Houston, Texas. Herman Memorial is integrated, and what we mean by integrated is that we own the hospital, we own clinics, have employed physicians, and we own an insurance company. We integrate the entire healthcare system. So in our minds, we can do things at a better cost to, number one, our patients and our members. We're trusted by over 245,000 members. I can tell you as of last month, that number actually was 248,953. So we're very proud of our growth. By the end of this open enrollment period, we believe that number is going to be well over 320,000 members. We're the number one rated commercial and Medicare carrier by the NCQA, and you can look that up on Consumer Reports. That number one ranking is for the Southwest. We're very proud to say that we're Texans serving Texans since 1982. I know that's only 33 years, but we're a part of an organization that dates back to 1892 here in Temple, Texas. That's when Dr. Arthur C. Scott started his surgical practice in Temple, Texas. We're not again, we're a nonprofit, so we're not a stock company. We don't send our profits to New York City or to Bluebell, Pennsylvania, or to Chicago or Los Angeles, California. We keep our money right in the state of Texas. We're Texans serving Texas. We're not a mutual company. We are a nonprofit, so we are a community-based company. Again, that's a selling point for you, community-based company. We're a leader in consumer satisfaction because we are community-based. We stress very highly on our satisfaction of our patients and our consumers, 2.5 times lower complaint ratio than the average in the state of Texas, and that can be found at the Texas Department of Insurance. One of the things that Mike wants me to talk about and that I do talk about is our approach to healthcare, and that is the integrated approach to delivery and to the financing of care. The thing that I want to mention is the data shareability. We as an integrated healthcare system can share data more so quickly than other providers of healthcare in the state of Texas because we own the hospital, we own the clinics, we have employed physicians, and they can share the data. The example we give is when your client goes to a doctor, the doctor orders will order lab tests, x-rays, he'll read those, he'll get them back, he'll bring his patient back in, and he'll say, I really need to refer you to a specialist. They go to the specialist, and what happens? The specialist reorders lab tests and x-rays. In the integrated approach to healthcare, we are very much wanting to share that data inside the system. And remember, that's the Baylor healthcare system in the Dallas-Fort Worth area, and in Central Texas, the Scott White health system. We think that that's going to be able to bring us premium predictability, and I'm going to use that. Just wait for that word, predictability. It's going to help us with our sustainability and our measurability and how we trend. Trending is a very important factor, but on the network strategy, our network strategy is definitely centered and focused. The cornerstone of that is the Baylor Scott White Quality Alliance. As you can see, I'm talking about ACA, so the commercial side of the business. We're in 77 counties. We have over 7,000 providers in the network and right at 69 commercial hospitals. And you can see our service area is right here. So we have a pretty large service area. For those in the Dallas-Fort Worth areas, we have 7 counties in and around the Dallas area. And so I'm going to dig right into the product line. You know, I told Mike that I was going to be probably the shortest speaker because, you know, we don't have the approval yet from CMS. And like he had said, it may be early October before we really can release what CMS approves. But we're going to talk about, first of all, our footprint and what we have to offer during the 2016 plan year. This is our HMO footprint, and I'm going to show you the next slide because guess what else we have? We have a PPO. We're going to be able to sell our PPO. It's been filed for sale both on exchange and off exchange. So you can see the difference. There's only 3 counties in the very south that differentiate us in our PPO network and our HMO. We're going to jump right into the benefits. Our benefits this year that we filed for the 2016 plan year aren't going to be that much different than the plans that we had last year. By the way, we did have a PPO last year, but it was only sold off exchange. This year we'll be selling both products, both on and off exchange. And so we're excited about that. Our HMO offerings, we're going to be able to offer 3 bronze plans, 4 silver, and 3 gold. We'll also have a catastrophic plan. One of the unique things about the bronze plans that we'll offer is we do have some bronze plans that your consumer doesn't have to reach their deductible to get first dollar benefits. We will have some bronze plans that do have limited number of doctor's visits at copay prior. Once they get to I believe it's 3 visits or 2 visits, depending on the plan they buy, they can go with copay. So it is a great option to look at. Look at our bronze plans because of the first dollar benefits instead of the large deductible that may have to be reached in one of the other plans. So again, 3 bronze plans, 4 silver, and 3 gold. And as you can see in the upper right-hand corner, that does say draft pending CMS approval, and it's possibly subject to change. We can't foresee any change at this point, but this is what our HMO product offerings are going to look like. One of the things I do want to say, and I promised my staff I'd say this, is that, you know, to this room, HMO is not a 4-letter word. HMO at the Scott White Health Plan is an open access HMO. What does that mean? That means that your consumer does not have to elect a PCP, and your consumer does not have to get referred to go to a specialist. It is an open access HMO. PPO, we're going to offer 2 bronze, 3 silver, and 4 gold. So we are offering our product. Sorry about that. The Baptist minister got out in me. So we're very proud that we are going to be one of the few. I don't know if we're going to be the only, but we don't know if there's going to be that many carriers in the market space with healthcare.gov that has a PPO. Again, the integrated approach to healthcare allows us to do things we think a little more economically. We have favored nation status with our own networks, so we think that because of that and because of the integrated approach, we're going to be able to manage care maybe a little bit better than our competitors, because not only are we an insurance company, but we're also a part of, again, the largest nonprofit healthcare system in the state of Texas. And again, nonprofit. So what are the important things that brokers need to remember about or need to know about Scott White? Well, first of all, we want to address some things that are, and I like this word, broker-centric. I don't even know if that's a real word, but we're going to use it today. Things that are broker-centric. Number one is we are getting ready to launch our electronic agent onboarding system. What that's going to allow agents to do is electronically onboard with us. Right now we have fillable forms and it requires them to be printed and mailed, but very shortly, and I'm talking within weeks, our electronic onboarding system is going to be operational. How about a direct enrollment system? We have contracted with a company that's in the process. Again, the open enrollment period starts November 1st. Our target date to be operational is 2 weeks prior to that. And what we're going to do is every agent that contracts with the Scott White Health Plan will be given a broker portal. That broker portal will give you as an agent access to our ACA direct enrollment system. What does that do? It, first of all, pre-populates all of the agent data. Why is that important? We all know that we had problems in the past two, the 2014 ACA enrollment period and the 2015. The government had a hard time attaching that NPN number in a lot of cases. It would come and it wouldn't be attached, or the government changed the feed that was given to the carriers. For example, the carriers would program for an 8-digit field in 1 month, and the next month the government sent a 9-digit field. What did that do? Screwed up all the programming, and insurance carriers had a hard time paying commissions. I'm going to tell you, and anybody that's been around me for any amount of time know that I live by 2 rules in my life. Rule number 1 is don't mess with my wife, and number 2, don't mess with my money. If you mess with my money, you're going to be messing with my wife. And by the way, I am very proud to say that today, September 17th, is my 27th anniversary. So we're going to have a broker portal for every agent, and it will be a way to do a direct enrollment system. And the direct enrollment system allows you to apply both on and off exchange. And when you do have a customer that needs to apply with a subsidy, the website of the Scott White goes on top of healthcare.gov, and it actually bounces back and forth between our website and healthcare.gov. And instead of a 45-minute process through healthcare.gov, it turns into about a 5 to 8 minute process. That's why we are promoting a direct enrollment system. Again, we're going to have a greater presence this year on healthcare.gov with multiple products. Last year on healthcare.gov, we only had the HMO product. This year, we'll have both products. The HMO and the PPO will be available both on and off exchange. One of the things that we as a carrier have decided is that we're trying to push, we're trying to achieve a goal of 90% electronic applications, but you know what? We're still going to offer paper for those agents that want paper. I'm not going to encourage it, but I'm going to tell you that we will have paper. I can tell you that in a previous life, you may have heard me give a speech about paper applications, but we know that some people do need paper. So we're going to try and push towards a 90+% electronic, but we definitely want to get that way, or get to we will have paper. And by the way, I have 3 minutes. I thought I was going to go short. I guess I am that guy that's 12:05. So we've improved our shopping experience for the buying public. And we've definitely got a better telephony system than we had last year. But, we had brochures in the back about our Elite Broker program, and so please stop by and take a look at that. But the most important slide I want to show you, and again, 2 things in my life don't mess with my wife, and don't mess with my money. So I'm going to show you the money. We're going to pay commissions on ACA products, whether it's on or off exchange, and we're paying a level 6% in all years on all ACA qualified health plan. So it doesn't matter if it's first year, second year, third year, fourth year, fifth year, 8th year, 12th year, 23rd year. It's a level 6% commission. So we're showing you the money. We're showing it right up front. We're being honest. We're being upfront. That's what we're going to do for 2016 plan years. So with that said, I'm going to tell you what our commitment is, again, as the largest nonprofit healthcare system in the state of Texas, and Scott White Health Plan being a part of that, our goal is to make insurance predictable, accessible through our strong integrated healthcare system, to make it affordable for your clients, and to make it sustainable, again, through the integrated healthcare system of the Baylor and Scott White Health System. Thank you very much.